There's 7 common myths when it comes to what people think about physical therapy. The first one is people think you need a referral from a doctor to be evaluated by a physical therapist. You do not actually need a referral to be evaluated by a physical therapist. It is encouraged, but it is not required. Second misconception or myth about physical therapy is it is painful. While there are some conditions where that is part of the process, we try to work within your pain-free range to accentuate or add to that range without causing pain. That is our primary goal, is to build our patients up without causing them additional pain beyond what they're already experiencing. Myth number 3, physical therapy is only for injuries or accidents. Yes, very true. We do treat people who've been injured, had surgery, been in car accidents. Some people just have some nagging pain, whether it be in their foot, their knee, their elbow, their shoulder, and there's usually little underlying things that physical therapists are trained to detect and look for and then treat to help eliminate those pains. So PT is for any type of pain or disorder you are experiencing. Or any healthcare provider can provide physical therapy. No. Nothing could be farther from the truth. Everybody who works in this clinic or any other PT clinic is required by federal and state laws to pass certain classes, graduate with certain degrees, pass national board exams before we can even step into a clinic to treat a patient. And all of that is to make sure that we're doing exactly what that patient needs to recover and get back their functioning. Myth number 5, physical therapy is not covered by insurance. Not true at all. While everyone's insurance varies, I would say I don't think I've seen a single policy that does not cover physical therapy. It may only be a certain number of sessions, it may only be a certain dollar amount, but physical therapy is covered by insurance. Number 6, surgery is my only option. Nothing could be further from the truth. Surgery should be your last available option, because after surgery, guess what you're going to need? Physical therapy. It's much better to start off with physical therapy, try and see if you can avoid the surgery. Because by having surgery, you're adding additional potential risks and or possible bad outcomes instead of coming in and seeing if we can get some strengthening and just some general joint or whatever the issue is, relief. And then the final one is I can do physical therapy myself. No, you cannot. You can work out yourself, but unless you understand how everything in the body interrelates, whether it be the nerves, the muscles, the fascia and different levels of fascia, if you can explain and understand all of those things, feel free. I'm guessing 90+% of the population cannot do those things. So unless you're in that 10% or less, please do not try doing physical therapy by yourself. You'll actually end up hurting yourself and making things worse more than likely. Okay?